Okay, my name is Rabwoni. I'm the Health Service Coordinator of Mobile Hospice in Mbarara. I have been working with hospice for the last 20 years and has been a great experience and growth. Okay, in day to day, when we come here in the morning, we meet in the hall, we pray, we share communication. People tell us so and so is going to leave, so and so is having a party. So these are kind of small communications. They are really very good for the team. Then afterwards, we prepare for the day. People will go to the hospital to see patients. Others will go on home visit. Others will stay at the hospice because most of our patients, they come here at hospice. So the person who is going to the hospital will leave around 10 after we have had a cup of tea. Then those on the homes, they will also leave. Then the people who are staying here, they'll continue seeing patients because as the patients come, they register at the reception. Then they bring their files into the clinical. They find their files, then a nurse goes and sees them in the room. Then they are given their medicines and they go home. So we do that throughout the day. We see like 30 patients per day. But still, when we go on home visit, we see patients, we give them appointments. When they come here, this is where normally we clerk our patients. We clerk our patients from here, or we clerk the patients in the hospital. Then we give them appointments where to meet them. That's how we see the patients whom we give you an appointment, we see you on the outreach, you will see you in the home, you will come back here at hospice. So that's how we give them the appointments and we write in our diary. We have a daycare. In the daycare we bring in patients who are lonely, who need to be with other people. We bring them from home, we bring them to hospice once a month on a Wednesday. And we put them in the hall, and the children can play around with their bicycles and their toys. The adults, they sit in, they talk to each other. It helps them to know that they are not the only ones who are sick. They share a meal. We give them a cup of tea when they come in. They watch videos, they watch plays, and the carers also get a day off to rest because all their lives they've been caring for these people. Day in, day out. That is the only day in a month when the carers also can do what they want to do. So then we give them a meal, and the evening the drivers take them back home. And they are reviewed by the clinical team. So that is our daycare. Then we have an outreach. The outreach, we go beyond our normal 20 kilometers. We go and see patients like on Ishaka Road. We find patients who are waiting for us there. There are many, and these patients, we started these outreach clinics simply because it was a long distance for patients coming here. And the second thing is, as the patients travel from wherever they are coming from, it makes their pain worse. So you don't know whether you've given them medicine or not. So we go to Ishaka, we find there are many patients, like 30, waiting for us. And we go in a team of 4. There's a driver, 2 nurses, 3 nurses and a driver. When we go there, we collect their papers, we give them a drink, we review them, we give them medicine, and at the end of the day, we come back home. We go to Ishaka, we go to Isingiro. Isingiro is more of a mobile clinic because we go to clinics like Nanziri's clinic, we stop there, visit patients. We go to Shungezi, we visit patients. We go to Chikagazi, so we find patients wherever they tell us, you find us here, that's where we find them. Have a community volunteer project. The community volunteers, these are people whom we have picked from the villages. We teach them about palliative care, tell them what kind of patients we are caring for. We show them how to dress wounds, show them how to help patients take their medicines, how to make beds, so these people learn. Then villages where we cannot reach, these people go there and see these patients, and we communicate with them. After every quarter, they bring their reports of the patients they have seen, and sometimes they refer patients to us, and they know some patients to refer to the hospital, to the health center. So these are very helpful people. These are part of the people who are village health teams. So they help in caring for the patients, and they help us with our work. And when we have anything here, those community volunteers come and work with us, like on Christmas, on memorial services, even community volunteers come and work with us. Project of Give a Chance has really given people a chance. These children, they are so miserable at home when their parents die and they have no one to take them back at school. They have guardians, fine, but they don't have the money to put them back at school. So these children, they stay home, they are really so miserable, but the minute they got this chance of going back to school, they really work very hard to see that they are also like other children. As much as they miss their parents, but at least they are still children. They can go to school, they can study, they can play, they can be children. Because once they stay at home, they become adults before they become adults. So this has really helped these children so much.